It's all about that trach, a project on building pediatric tracheostomy educational tools for healthcare professionals and families. Tracheostomy care is complex and critical, and for these children, airway management is an absolutely essential part of their daily care. Teamwork is critical and essential, and because of this is quite daunting and intimidating to families and medical trainees. This makes continuity, communication, and consistency key features of management in the care for these children. Although the current information and training materials are able to get the job done, there are inconsistencies that lead to confusion. Thus, the aim of my project was to develop teaching materials for PEDS trach care and management. Our aim was to create a number of different simulation scenarios that could be used for training with both medical trainees as well as families of these children. Our goals for the simulations was to have a broad range of topics covering things from general day-to-day care and also include more urgent and emergency scenarios. We wanted to focus on strengthening the skills and building confidence in supportive and low-stress environment. We also wanted to have the scenarios built in a way that they could be used for both in-person workshops as well as be available online as review modules. An example scenario is that after feeding, a 5-month-old boy with a trach vomits up most of his formula and then develops increased work of breathing. In these scenarios, trainees are given specific information on patient status and condition, and they are expected to react appropriately with correct answers to prompting questions. Each scenario then ends with a debrief and questions on the trainee's level of comfort, as well as feedback on the scenario itself as an inbuilt tool for quality improvement. Our simulations were sent to evaluators from various medical disciplines, as well as a few families as well of these patients, for feedback, and they reported that our scenarios are indeed useful for adult learners with diverse backgrounds. They are effective for reinforcement and they are good reference sources. They're not intimidating and help build good confidence. Currently, we are working on incorporating feedback such as the need for visual aids, commenting on patient positioning and management of GI tubes, as well as abnormal versus normal findings, etc., into the newly developed scenarios, with the hope that we will be able to release them soon for use in training to help improve the care for children with tracheostomies. Thank you for listening.